Good afternoon, I'm Ben Dolewski and I am the Southern Region Operations Director for Valley Health, which I supervise the outpatient clinics in Page County, Shenandoah, and Warren County. And additionally, I'm the Executive Director of the Page Free Clinic. Happy to call Page County my home for the last 9 years, so my wife and I live here. She also works for Valley Health up the road in Warren County, but we both call Page County our home and very happy to be here. So the Free Clinic's been in existence for about 12 years now, and we serve under or uninsured residents of Page County. So we look at an income scale of 0 to 200% of the federal poverty level and provide primary care services, women's care services, lab services, prescription assistant services, and also diabetes education. So thinking about rewarding experiences, there's one patient in particular at the Free Clinic that had chronic diabetes, had some other underlying health conditions, and we were running a free diabetes education and exercise program. My background is actually in exercise, and that's when I first moved here to Page County, was working at the fitness center. And then having my background with James Madison University, we partnered with their nutrition and dietetic department. And what we did was offer a free community program to learn about how to exercise properly, how to eat properly, how to shop on a budget. So it was an 8-week program where we did weekly check-ins. We were able to get folks free memberships to local fitness center and had one-on-one coaching with the JMU students. And when that program finished, this one individual said if it wasn't for us, he'd be in a much worse state. He may even have passed away. That we were able to get his blood pressure under control. He felt like a new man. He would actually come in and bring us gifts. He was a local artist, and we have a few of his paintings here in the building to recognize him. But that was just a rewarding experience. Every day, you know, we want to give back to the community, but hearing the community come in was a very rewarding experience. What drew me to Page is the proximity to things like Harrisonburg, Charlottesville, Washington, D.C., where we're still in sort of a rural setting. It's a little bit quieter, but easy to get to places. And I know it sounds a little funny growing up in New York. I was 40 miles outside of New York City, and I think my graduating class was about 1,200 people and moved to a town about 5,000 people, so a big change. That's what I like. What drew me here is the open space, a lot of outdoor activity. I go through one stoplight to get to work and it takes me 2.5 minutes. What I really enjoy about the community is how supportive they are. I used to get, "You're not from around here, are you?" 9 years ago, I guess I had more of a New York accent and clearly didn't have the, I guess, local Page Luray dialect, so it was clear I didn't grow up here, but immediately was taken in. Made a group of friends and acquaintances that really helped me explore the area and understand the different services and things that Page County had to offer. And likewise, as I grew and expanded my roles here in Page County, what I came to find out is how supportive the community is. So, for example, here at the Page Free Clinic, the operating income really comes from a lot of donations and community businesses that really help us keep our doors open and keep our services 100% free. If we were in a different community, I'm not sure if that would be possible, but here in Page, it's great. You know, I see our future here in Page County is optimistic, and there's a lot of exciting things going on. So, for example, at Valley Health, our clinics here in Page, we're recruiting a lot of new providers. So we have new physicians and new nurse practitioners coming in. Growing our services and being able to provide quality access to healthcare is very exciting for Valley Health. What really attracted me to Page County was the people and interacting with the people, but at the same time, seeing that there was a need for healthcare and other services. So absolutely, that this is a great opportunity to provide those healthcare services 100% free and give back to the community and see changes really actually taking place here, seeing people's healthcare improve, hearing success stories that, you know, maybe someone lowered their blood pressure or, you know, referred someone to the clinic that previously wasn't seeking healthcare. So really, that's what makes it all worth it.